Hey y'all, I'm Ernice. Welcome back to my channel where we talk about everything between healthcare and the law. And I also do case studies and reviews of articles related to healthcare clinicians, but specifically mostly nurses. Today we're going to talk about something that's extremely difficult. I'm giving you a trigger warning now. If you don't want to hear negative commentary or a negative story, then I would say this isn't the video for you to watch. It is one of the saddest things that I am going to share, but it needs to be discussed. If you like this type of content, make sure you like, comment, subscribe, and of course share with your community as well. And if at any point you have any questions, please feel free to drop them below. Also, I linked the article below so that you can follow along, so that you can also share and read and really, use this as a resource and a tool. If you're an educator, this is a great article for you to share with your community and with your students who could potentially be asking, like, what are the dark sides of nursing? Like, what else, right? Because although we talk about the positives and the great things that happen, there are also so much that happens in between. So if you didn't know, I'm from Connecticut. This story happened in Connecticut, which shook me even more because I'm from a very small town. And this city, Willimantic, is about an hour north of me and is also a very small town. I also have worked in home care. I worked as a hospice nurse, so going to different patients' homes at the end of life. And you never know what you're going to walk into or what your experience is going to be. Thankfully, I had mostly positive experiences. I don't really remember having too many negative experiences, but there were times where people made me very uncomfortable, and either I wouldn't visit them alone, or I essentially said I'm not going to see that patient, and we would have one of our male colleagues go and see the patient because it was just that difficult. So this nurse, again, trigger warning if you're sensitive or you just don't want to hear about a negative story, because there's not much that's going to come from this that is positive, but again, it's a story that needs to be shared. A nurse in Willimantic made a visit to a patient who was on her caseload, and of course they're already dealing with staffing shortages and a lot of caseloads, and of course there aren't a lot of people who want to do home care. But Miss Joyce Grayson, she was a 63-year-old mother of 6, went to this halfway house that houses sex offenders in October to give medication to a person who had a violent past. She didn't show up to the rest of her visits, which then alerted her coworkers and her agency. And of course, they immediately started looking for her, and eventually they found her in the basement of this suspect's residence. And the person who she was supposed to be given the medication to was a suspect in this case. This situation, when it was shared, when it was posted, shook me because this could have been me. It could have been any of the colleagues that I know, and it could be millions of nurses who are out there who work in home care, whether it's infusions or whether it's hospice or just regular, home health. This conversation led to a occurring conversation that we kept having, and really brought to light that we need laws in place to protect healthcare workers. We need laws in place. We need safety measures in place. We need support. We need funding. And, her peers, as well as other lawmakers who have been on the side of nurses and healthcare workers, are saying, like, how can we expect people to go into someone's home and not make it out and not do something about it? And so that means if they need escorts, or if we need more information about patients and their background, we need that information up front so that we can make a decision if this is safe for us or not. Yes, this patient may have needed their medication, but maybe they need to go to a location to pick it up versus someone coming into their residence. We have been talking for many years about increasing violence against medical professionals, and there haven't been any federal laws that have been passed to protect nurses or healthcare providers, despite the fact that we have seen an increase in violence, especially since the pandemic. And so, I want to honor, Miss Grayson and the life that she has lived and the service that she has given to her community. To be 63 years old and still working and still caring for patients means that she truly had a heart of gold, and that she was, compassionate and passionate about the work that she did in being a nurse. But also, it's a reminder that we have to keep having the conversation about what we need and why we need it and why we need it now. And so I get politics can be extremely difficult. I'm completely turned off sometimes during midterms and, general elections, when there's just constant bombardment of negative news and arguments and divisive things that are happening. But we can't stop advocating for ourselves just as much as we advocate for our patients. And there are laws and bills, or there are bills that have been out there that have been presented to Congress, and they never make it to the table to even be discussed about why we need it. Right? We say we need these protections, we need more laws, we need, harsher penalties for people who do harm healthcare workers. And somehow that gets lost in the noise of travel nurse pay and nursing shortages and why nurses want more money and how nurses and nurse practitioners make more than residents, despite the fact that we all need this. And so I'm sharing this story not just to, have a negative conversation, because that's not what it's about, but to just shed light on, if we don't take action, what is happening and what is going to continue to happen. So if you're a nurse, you work in home health, you work in hospice, you do any type of home care, please, let me know what you're doing below. Share that in the comments. I applaud you. I know how hard you work. I know the work that you do. And I'm just so grateful for you, because it may be me when one day I need someone to come into my home and care for me or my family member. But, if you are a part of the community and you're not a healthcare worker, please support us in our efforts to protect ourselves, to also be able to care for and protect you as well. So thank you so much for watching. I'm sending so much love and prayers to the people of Willimantic, to the family of Miss Grayson, and, to the justice system that now will ensure that she gets some form of justice, despite the fact that she can never return home. So again, if you want to continue to have these conversations about what is happening in the healthcare world, what is happening to and around nursing, make sure you like, comment, subscribe, and feel free to share as well. If you have any questions, drop them in the comments below, and I look forward to speaking to you all again soon. Take care.